Good afternoon, guys. Now we're going to discussion A. We're going to discuss what Medicare doesn't cover for services, medical services like um, dental, vision, hearing, those kinds of things. So please join me for today's discussion A. Okay, here we go. Medicare leaves several major gaps that catch people off guard, especially dental, vision, hearing, long-term care, and many everyday services that feel medical but aren't covered. These uncovered expenses can create real financial strain for older adults on fixed incomes. The most commonly ignored Medicare expenses. Below is a clear, structured breakdown of the cost Medicare doesn't cover. Okay. Even though many people assume it does. Dental care. Medicare does not cover routine dental care, cleanings, fillings, crowns, dentures, or implants. Why this matters? Why it matters. Dental care is one of the biggest out-of-pocket burdens for seniors, making up nearly 39% of all dental spending. Workarounds. Some Medicare Advantage plans offer limited dental benefits, otherwise private. Dental insurance or discount plans are needed. Two, vision care. Original Medicare does not cover routine eye exams, glasses, or contact lenses. Covered only when medically necessary. Cataract surgery, glaucoma treatments. Workarounds. Standalone vision insurance or Medicare Advantage plans with vision benefits. Hearing services. Medicare does not cover hearing aids or routine hearing exams. Cost impact. Hearing aids can run $1,000 to $6,000 per pair. Workarounds. Discount programs or advantage plans that include partial hearing benefits. Long-term care, the biggest blind spot. Medicare does not pay for assisted living, nursing home custodial care. Long-term care, memory care. This is the single largest uncovered expense most seniors face. Cost impact. Nursing homes average over $100,000 per year. Workarounds. Long-term care insurance, Medicaid planning, or restructuring assets. most prescription drugs under Parts A and B. Medicare Part A and B do not cover most pharmacy-filled medications. You need Part D for drug coverage, which comes with premiums, deductibles, and copays. Even Part D expect to pay up to $2,100 out of pocket in 2026 before protections kick in. 6. Routine foot care, chiropractic care, massage therapy, and cosmetic procedures. These are not generally excluded unless tied to a specific medical condition. Examples not covered: routine podiatry, most chiropractic adjustments, massage therapy for pain, cosmetic surgery, foreign travel, medical care. Medicare does not cover medical care outside the U.S. Workarounds. Some Medigap plans include limited foreign travel, emergency coverage, concierge medicine, and membership-based care. Annual fees for concierge or VIP medical practices are not covered. Why it matters: these models are growing, and many seniors don't realize Medicare won't reimburse any portion. 9. Routine home modifications and mobility supports. Medicare does not cover grab bars, ramps, walk-in tubs. Most mobility equipment, unless medically necessary. These are often essential for aging in place, but must be paid for out of pocket. 10. Dental related medical complications, unless narrowly defined. Medicare only covers dental services when they are part of a covered medical procedure, e.g., dental exam before organ transplant. Routine dental remains excluded. Why these gaps matter for families and caregivers. For caregivers, especially those supporting elders in assisted living, home care, and multi-generational households. These uncovered expenses can derail budgets and force crisis-driven decisions. They also shape conversations about when to transition to higher levels of care, how to plan financially for long-term supports. What supplemental coverage, Medigap, or Advantage is worth the cost? How to protect dignity and comfort over time. This aligns closely with your work, Felicia, helping families anticipate these gaps before they become emergencies. A next step for you. Okay. Okay, here's part 2 of today's A for you. You've been warned. Medicare won't cover these 13 medical costs for seniors, based entirely on the content of the page you're viewing. Core meaning of the text. The article is a consumer warning. Despite Medicare being the primary insurance for older adults, these are major gaps. 13 categories of care and services that Medicare either never covers or covers only narrow circumstances. The piece walks readers through each category, explains why it's excluded, and highlights the real world financial impact on seniors. It also frames these gaps against a backdrop of rising Medicare costs. Upcoming 2026 changes that may make access harder. Widespread misconceptions among older adults about what Medicare actually pays for. The tone is cautionary. Don't assume Medicare will take care of everything. What the article is really saying, organized by theme. Medicare excludes many everyday health needs. The article emphasizes that Medicare's design is medical event focused, not holistic. As a result, seniors must pay out of pocket for routine or maintenance services such as dental care, cleanings, crowns, dentures, vision care, routine exams, glasses, contacts, hearing care, hearing aids, most hearing tests, routine foot care, routine physicals beyond the annual wellness visit. These are framed as surprising but costly blind spots that catch seniors off guard. Medicare does not cover long-term care. This is one of the article's biggest warnings. Medicare does not pay for assisted living, custodial care, help with bathing, dressing, toileting, long-term home care. The article notes that 62% of older adults mistakenly believe Medicare covers long-term care, even though 70% of people who reach age 65 will need it. This mismatch between belief and reality is a central concern. Some services are covered only in narrow, medically necessary situations. The article repeatedly clarifies that Medicare sometimes covers a service, but only if it is tied to a medical procedure. It deems medically necessary or it meets strict diagnostic criteria. Examples: cosmetic surgery is covered only after accidents, cancer treatment, or functional impairment. Acupuncture is covered only for chronic low back pain up to 20 sessions. Chiropractic care is covered only for vertebrae subluxations. Foreign hospital care is covered only in rare geographic exceptions. These carve-outs are meant to show how narrow Medicare's definitions can be. Prescription drug coverage is limited and still expensive. Even Part D, seniors may only pay up to $2,000 out of pocket in 2025, rising to $2,100 in 2026. Many drugs aren't covered. Part B drugs follow different rules. The article also notes globally supply chain issues and potential tariff impacts on drug prices. Medicare does not cover the cost of Medicare itself. This is one of the hidden costs the article highlights: premiums, deductibles, co-pays, extended hospital stay costs. For example, after 60 days in hospital, copays jump to $419 a day, then $838 a day after 90 days. Deductibles $1,676 for Part A, $257 for Part B. In 2025 are entirely the patient's responsibility. Alternative therapies are almost entirely excluded. Massage therapy, acupuncture, except for chronic back pain, and many complementary treatments are not covered. The article emphasizes how quickly these costs can add up. $60 to $300 per session for massage, $75 to $300 for acupuncture. Concierge medicine fees are not covered. Membership fees for boutique or VIP medical practices must be paid out of pocket, even though Medicare will still cover medically necessary services provided within those practices. The article, the article's underlying message: the price is is essentially saying, or the piece is essentially saying, Medicare is essential, but is not comprehensive. Seniors who assume Medicare will cover it, many face large, unexpected bills. It encourages readers to understand the limits of Medicare, consider Medicare Advantage or Medigap for partial relief, plan financially for uncovered services, explore community or nonprofit support for dental, vision, and foot care. Okay, guys, that is your A. I will be back on with B shortly. Give me a bit for a break, please, and I'll be back with you for B. For now, Gator Wellness, take care, folks.